Hello everyone, in this video we will be seeing hydrotherapy, also called as aquatic exercise. Aquatic exercise refers to the use of multi-depth immersion pools and tanks for the therapeutic purpose that include stretching, strengthening, joint mobilization, balance, gait training. Goals and indications for aquatic exercise: facilitate range of motion exercise, initiate resistance training, facilitate weight bearing activities, provide three-dimensional access to the patient, facilitate cardiovascular exercise, initiate functional activity replication, minimize risk of injury, enhance patient relaxation. Contraindications: incipient cardiac failure and unstable angina, respiratory dysfunction, severe peripheral vascular disease, danger of bleeding or hemorrhage, severe kidney disease, open wounds and skin infection, uncontrolled bowel or bladder, typhoid, cholera and polymyelitis, gastrointestinal infection, uncontrolled seizures. Precautions: fear of water, neurological disorder, seizures, cardiac dysfunction, open wound. Properties of water: buoyancy, it is the upward force that works opposite to the gravity. Properties: Archimedes principle, it states that an immersed body experiences upward thrust equal to the volume of the liquid displaced. Clinical use: decrease stress and compression on weight bearing areas of the body or tissue. Hydrostatic pressure is the pressure exerted on the immersed object. Properties: Pascal's law states that the pressure exerted by the fluid on an immersed object is equal on all surfaces of the object. As the density of water and depth of immersion increases, so does hydrostatic pressure. Clinical significance: increased pressure will limit effusion, assist venous return, induce bradycardia, centralizes peripheral blood flow. The proportionality of depth and pressure allows patients to perform exercise more easily when closer to the surface. Viscosity is the friction occurring between molecules of liquid resulting in resistance to flow. Properties: resistance from viscosity is proportional to the velocity of movement through liquid. Clinical significance: water's viscosity creates resistance with all active movement. Dangers: allergy can be developed because of the chlorine water, fatigue due to overexercise in water, spread of infection, sleep accident. Hydromechanics comprise the physical properties and characteristics of fluid in motion. Components of flow motion: laminar flow, movement where all molecules move parallel to each other, typically slow movement. Turbulent flow, movement where all molecule does not move parallel to each other, typically fast movement. Drag, the cumulative effect of turbulence and fluid viscosity acting on an object in motion. Clinical significance of drag: as the speed of movement through water increases, resistance to movement increases. Stretching exercise: patient may tolerate immersed stretching exercise better than the land stretching because of the effects of relaxation, soft tissue warming and ease of positioning. Strengthening exercise: by reducing joint compression, providing three-dimensional resistance and dampening perceived pain, immersed strengthening exercise may be safely initiated earlier in the rehabilitation program than traditional land strengthening exercise. Both manual and mechanical immersed strengthening exercise typically are done in waist depth water. Physiological effect: cleansing, water can be used as a cleanser. Musculoskeletal effect: decreases weight bearing, increase blood flow to the muscle, helps in muscle strengthening. Cardiovascular effect: increase venous circulation, increase cardiac output, increase cardiac volume. Respiratory effect: increase work of breathing, decreases exercise induced asthma. Renal effect: increase urine production, increases sodium and potassium excretion, control hypertension and peripheral edema. Therapeutic effect: relief of pain, muscle spasm, body relaxation, balance and coordination, increased strength of muscle.